Fighting fires is a tough, dangerous job to begin with, and it's even more so when there's a surge of coronavirus within the ranks. As Jason Doyle reports, that's the case for our state's largest department right now.
The Oklahoma City Fire Department is working through the largest surge of COVID-19 quarantines of firefighters since the pandemic began.
As of last week, we went as high as 116 in quarantine, which was probably our highest that we've had during this whole COVID crisis. So that is actually a spike for us, and those numbers resulted in us going to level red.
Oklahoma City Fire employs approximately 1,000 firefighters. That means just last week, more than 1 in 10 could not come to work. But those numbers are coming down.
So as of right now, we're starting to see a slight improvement in the quarantine numbers coming down, and the COVID numbers hopefully will be coming down here pretty soon too. But again, we just don't know what's going to happen.
Up the Turner Turnpike, the Tulsa Fire Department is dealing with quarantining too.
It's been up and down. 2 weeks ago, we had over 100 on quarantine, and we have around 700 people. So 100 is a significant amount. That means you're calling back overtime, which costs extra money. And we all know during these COVID times, money can be tight.
Even small town fire departments like the one in Union City are dealing with COVID impacting the staff.
We have had a few positives. It's really hard to pinpoint exactly where they get it. Whether they get it here or they get it at Walmart or whatever the case may be.
Regardless of how many firefighters are in quarantine, fire departments still must respond to fire and medical calls, and they're taking measures to help make sure those calls are approached as safely as possible. For example, shift change used to be a social event for staff to exchange information.
That's not something we're doing face-to-face now. So we're having our off-going shift leave the station. The ongoing shift is waiting outside. They come in, so there's not contact between those two shifts.
Life at the fire station, to be honest with you, has changed. There's a lot of tradition in the fire service, a lot of camaraderie, brother and sisterhood, things like those you hear a lot about. Well, that has been affected since this all started.
Training is different too.
We don't do as much classroom stuff right now where we're all in the same room at the same table. We try to stay spread out and do a little more, as much outside training as possible, actually.
Well, that has all been stopped. We no longer are doing any intercompany training while we're in this level red. All training is done only at your fire station. So that's another step to try to keep people from being exposed to other people, even if it's our own firefighters.
All three departments say they're taking extra precautions when going to a medical call.
When we show up, if the patient is able to walk outside, if we know that's not going to affect their care or anything, we will allow them to come outside.
So when there's cardiac arrest, a fire, you can't change the way you do that. You're all going in. But if it's a headache or some lower wound or something, we would send one firefighter to the door to make contact.
If they have any of the symptoms, then for instance, if they answered yes to one of the questions, obviously, if they're able, we would then pass a mask to them through the door and have them put that on. And we would also be, have all of our PPEs on, which is personal protective equipment.
Keeping the stations and equipment safe and sanitized is a priority. The Tulsa Fire Department got creative, using old self-contained breathing apparatus retrofitted to spray hypochlorous acid to kill the virus.
So you hook this up there, you put the chemical in there, and it sprays a super fine mist. It's not something you had to wipe away, and it has a kill rate of it's like 60 seconds when the bacteria is dead. So those firefighters can put that backpack on. They can walk around the station, disinfect everything multiple times a day.
In Union City, a major donation helped that department address its PPE needs.
I can't give them credit because I don't know who they were because they didn't really leave a lot of information, but there was a big oil field company that all of a sudden a bunch of supplies showed up at our station.
The pandemic also interrupted a holiday tradition at fire stations.
Because we're away from our families, and with those second families, we often have big meals at the station and allow our wives and children or husbands to come up and enjoy that meal with us. And that's not something that we were able to do for Thanksgiving or likely for Christmas either.
All this so when someone calls 911 for help, our emergency responders can respond.
We just want our residents to know that we're still there, and we're at full speed, and we're going to do everything we can to continue our service.
Jason Doyle, the Oklahoma News Report.
Jason, thank you. The Oklahoma City Fire Department tells us that 70% of the calls they receive are medically related calls, which increases their chances of being exposed to the virus.